Alrighty, welcome everyone to another episode of Empower Speaks Healthcare Talks. As always, I'm going to give you a bit of background information of what Empower Speaks Healthcare Talks is. So as the name suggests, empower. The idea is to empower you through knowledge. Whether you are a patient, whether you are a clinician, whether you are in senior leadership or an entrepreneur, the idea is to bring these guests to have these conversations. And we hit various themes. Their personal journeys, right? In terms of the healthcare system, the whole focus is in the healthcare ecosystem. So let's understand some of those challenges. Let's pick their brain so we can understand what gaps they are addressing to in turn get that knowledge from them and empower you. So today I have a very special episode with two guests. So usually we have one, but today we have two. We have the co-founders of Scribeberry. We have Amaan Rattansi and then we have Dr. Zaahir Moloo. So before I hand it over to both these gentlemen, I want to share the backstory like I always do. How did I even get these guests? So Amaan had reached out to me over LinkedIn last year. So last year during the FLIP conference, so that's the Future Health Leadership, Informatics and Policy conference at the University of Toronto. So I moderated a panel and that panel had actually made it on the front cover of the Canadian Healthcare Technology magazine. And so he'd seen that. And so he reached out to me over LinkedIn and we connected. During our call, he actually told me, I saw your face all over LinkedIn. So I reached out and look at us today. So they're here as guests. So super pumped to have both of them on. And so before I hand it over to them, I just want to let you know what we want them to dive into. So we'll hand it over. They'll share a little bit about their journey. But we want to understand they're both entrepreneurs, right? But one is a clinician, one is not. And in the audience, we may have a non-clinical individual that may want to dabble into the entrepreneurial space. We also may have a clinician that also wants to do the same. So we're going to pick both their brains to understand how did they get there. So Amaan, I'm going to start with you. If you could share a little bit about your background being a non-clinician, how you got into the space, how you became an entrepreneur. Did you always think that you would end up here? And then once you wrap up, then we'll hand it over to Zaahir. So yeah, Amaan, take it away first.
Yeah, sounds good. Yeah, thank you so much for having us on, Fahreen. Yeah, so I mean, I didn't think that I was going to be an entrepreneur early on. I kind of grew up in healthcare. So like my family has like an orthopedics clinic since basically I was born. And so I was constantly surrounded by it. But yeah, I was always focused on the tech side of things. So as like a software designer / engineer for the last like 10 plus years, I was like always like in tech. I was always like tinkering with like different kind of things, obviously working in like some tech companies, but then also like tinkering on the side. But then I always had that like healthcare kind of background that my family had. And so, yeah, I mean, I think Zaahir will tell a better story of kind of how Scribeberry came to be, which is what I am a co-founder of, because I think the idea came from him. But yeah, that's kind of my background. I don't know if that answers your question, but yeah.
No, that does. Because I think always, like, even when I talk to individuals in my network that are thinking of starting their own, they're always lacking one side. They're like, I have to find a CTO. I'm lacking the technical side. I have an idea, but I don't have the expertise to build it. Or on the flip side, right? Like you have the technical expertise, but you don't have the clinical to back you up on that. And then you have an idea and you don't know how to break into this space. So I think the both of you complement each other very well. So appreciate you sharing that even though you're non-clinical, you have that technical expertise. So Zaahir, I'm going to hand it over to you. And before I do, just so everyone knows that Dr. Zaahir Moloo is a family physician by background. So I'm going to hand it over to you to kind of share your journey to entering medicine, to becoming a physician, a family physician. And then finally, how did you end up coming up, with Scribeberry, and what maybe gaps that you experienced in your own practice?
Yeah, for sure. So I guess my entrepreneurial journey, and then that's one aspect, and the other is more like the clinical side. Just personally as a background, I think there's one other doctor in our family, and that's it. My dad's side of the family, everyone is pretty much a business owner. So I think that kind of runs in the family and growing up in the environment. So my dad has his own travel agency, just watching that, watching him run that my whole life has kind of been a source of inspiration. So that's kind of the, background. In terms of medicine, obviously, I finished medical school, started practicing out in Spruce Grove, which is kind of not rural, semi-rural, and quickly found that, I had a large patient panel, 1,800 patients or so, and the admin work was what was burning me out. And with that in mind, I started to hack together kind of this no-code early version of Scribeberry that actually didn't involve AI scribing. It was more macros and kind of workflow automation. And then went to Amaan with the idea and said, hey, let's build this out. And Amaan and I are friends. We play soccer together. And it was just kind of organic. Put it together. We put it out for free, and then it gained a lot of traction. And then, yeah, we just organically kind of grown since then. So
that's incredible. And it's kind of funny that both your stories, like for Amaan, he's like, I have like other physicians in the family. And then on your side, you're like, I have some family physicians or physicians in general, but a lot more business. So it's funny how the both of you complement each other, even as opposites that way, that you're in that regard. But so appreciate you sharing your journey. So when you did come together, you said you started off, offering it free as a free service. So from that, how did you develop to where you are? Because you have expanded. So how did you break into the market? How is it just organic, word of mouth, marketing? How did you break into it? Share that journey with us up until today. Either one of you can take
it. Yeah. So I think like first off, our timing was right? Like when we first launched, there weren't many players in the space, and we were one of the first products. So that's one. I think there's a bit of timing and luck. And then the second is that I think we really understand the workflows really well of the clinicians using the product. So, just coming at it from that clinical perspective, whether it's forms, whether it's, templating, whether it's scribing, whether it's macros, whatever it might be, just how do you save time? And so that's kind of what we focused on, and we moved fast. Like that's been our kind of go-to. And Amaan, I don't know if you have anything.
Yeah, I think the important thing is like we moved like really, really quickly. I think we quickly understood what the problem was. And again, it comes back from even my own home, like growing up in a family that has like constant administration work within healthcare. And then my wife is also a physician that and I see her every day kind of doing stuff on the computer. So yeah, like I think both of us understood the problem really well, but we went to things like Facebook groups. We went and spoke to like a lot of our end users, like almost very early on to understand what that was, but then also like showcase it to them. And so we give it to them like as a bare bones product and be like, oh, what do you guys think? And we got a lot of feedback. And so a lot of folks were super, super interested in the product like very early on. And that's where we decided, okay, maybe we should also build this out into like a full featured platform. So yeah, I think from the start, it was like Facebook groups is kind of how we got the word out.
Yeah. That's incredible, because I think people wouldn't even think of that, right? We usually, whenever we want to start something, we think much larger, how to tackle it on a larger scale, but sometimes just starting with, basic, like you said, and Facebook, and that's how you've been able to grow. And I think what you're tackling, I think is so important. We've seen, especially through the pandemic, right, a lot of burnout amongst our clinicians. And so I think that's so critical. That is a pain point that you guys are addressing. Actually, one of my clients in my previous workplace she was, I believe, the chief of digital information officer. And she had told me, she's like, and she was out east, they were located out east. And she had told me, she's like, a lot of my physicians, Fahreen, are choosing to find places to work closer to home. Making the trek out is not worth it. And she's like, my physicians that are left, when it comes to documentation, she's like, Fahreen, if we're short, she's like, I'll see patient A on Monday, and they will not get to documentation till Friday. By the time they get to it Friday, they do not remember everything. So the notes are going to be bare bones. Let's say that patient A presents again the next week in the ER. When that physician goes to look in, the notes are going to be bare bones. So you're going to regather that information again. And so I think documentation is a key piece that a lot of, not just physicians, clinicians in general are experiencing. So how to augment that so that your time is effectively used to provide care. Zaahir, because you are a physician, like please feel free to add in, chime in. These are just what I've heard. I am not a clinician, but do want to hear your thoughts on that. Yeah.
So I mean, like the paperwork side of things takes an hour to 2 hours a day. And, let's say you finish clinic at 4, there were times I would leave work at 6 or 3. So it's a huge burden. And I think every doctor, physiotherapist, whoever does any documentation knows that. So that's the problem we really set out to solve. And there's so many different facets of it, right? There's forms, there's note taking, there's referrals, there's going through tasks, there's faxes, and so we've just looked at so many different ways to automate a lot of that. So far, it's been going well.
And do you use Scribeberry for your own practice now that you built it? Are you your own test client? Or
I mean, I was a test case number 1.
What?
And I still do occasionally. It depends on the patient. So I work in mental health now, and so just being cognizant of that. Sometimes, there are certain, let's say, patients I don't want to necessarily use the tool with, but whenever patients are okay with it, I will still use it.
When you say that if the patients, you mean like consent to use the tool?
Yeah,
Like
yeah,
to
exactly.
consent. Okay,
Yeah.
okay. No, that's fair. So now maybe we'll move more to the product side, and Amaan, feel free to chime in here. So I'll share a bit about, so where I work right now, we do also have an AI scribe, and we were actually talking about this before our call today. So I'll give a bit of background information, then I'm going to let them, Amaan or Zaahir, either one of you can take it away to share what your tool offers. And so my background right now, so I work at a company that is a telehealth and patient portal in the behavioral health, mental health space. And so we integrate with specific electronic health records. And so our AI scribe is specific to our products. So the way it works is it's integrated as an extension, basically. And so you have to log into your electronic health record as a clinician, and then you're able to use the AI scribe. You can use it for in-person sessions. So your device, your phone, your laptop, you name it, your iPad can use that to record your session. Or if you're offering telehealth through Zoom, it records it, it transcribes it, and then it helps populate set templates for the clinicians. At the end of the day, it is based on their discretion to review it. And then based on that, they populate it. We've got a lot of positive feedback where a lot of the clinicians tell us it's better than their notes, but that just to give experience to the audience that, in our space, what it looks like. So for both of you, if you're able to share a little bit about your product, how is it used, the product features of it. Yeah, so I'll hand it to you, Amaan, or Zaahir, either one of you that want to take it away for us.
Yeah, no, sure. I mean, just to begin from like almost 2022 or 2023, with the proliferation of AI in general, right? Like basically Chat or OpenAI released like this new model called GPT, and it was like very advanced in terms of its generative AI. And so since then we saw like a lot of like proliferation in AI applications. And we were fortunate enough to be like at that early stage and kind of lucky almost to get it kind of in the real world. And so that AI scribe portion of it was like the very initial like feature of like an AI scribe for healthcare. And so that's kind of what our starting point is. So we have like the AI scribe, which is like our starting point. But then now that we've kind of been in the business for over two years now, almost 2 years now, right?
Almost 2 years.
Yeah, like we've been able to build a couple more features like that kind of align with like several healthcare professionals, not just physicians. So now we support like a lot of ancillary care, like nurse practitioners, even like chiropractors, physiotherapists, like orthotists, prosthetists. So there's quite a number of like larger kind of healthcare professionals that use Scribeberry now, and it comes back to some of the features that Zaahir mentioned. So we have like this thing where it automatically fills out forms for you. So one of the things kind of even during COVID was healthcare professionals are inundated with like a lot of forms they have to fill out. Again, kind of taking away from the reason they entered into the healthcare space, which is like to take care of the patient, not do paperwork. And so one of the things we just released recently is the ability for Scribeberry to automatically fill out forms for you. So you can have that same conversation with your patient, and it will, in addition to generate your SOAP notes or whatever medical note that you want, it will also fill out any forms. So if you think of like ODSP forms or ADP forms or like billing or like insurance form, it will automatically fill that out. Again, just taking the time away from the administrative side of things for the physician or the healthcare professional. But then, yeah, we've added a number of other features that kind of differentiate us as well. Like we have like macros. So if you think of like dragon dictation, which is very commonly used on the dictation side for physicians, we have like a macros feature built into Scribeberry that kind of does very similar things and a lot more. And then we have customization of templates. So for example, my wife is a specialist, so she's an OBGYN. They have a very specific workflow, and it's not the same as primary care physicians, right? And so for her, she's able to customize templates, customize consult letters, like do like letter of records, like a bunch of different things that she can do using customizations, which many other like AI scribes don't offer at the time. But yeah, there's a lot more. I'm probably rushing on just a few. I don't know, Zaahir, if you can think
One
of
of the
any
cool
others.
things we're building out right now too is the kind of an AI agent that automatically takes histories for doctors or clinicians. So, the clinician just sets the patient's name, and then the agent goes out, takes the history, brings it back into Scribeberry, and in the future, hopefully their EMR. And then the clinician can pick up that note and finish the visit. So now you have kind of these pre-charts being created. And a lot of clinics use that workflow right now with let's say a resident or a nurse that takes that initial intake. So yeah, just doing away with kind of forms beforehand, pre-interviews, intakes, the actual interview, and then after the fact being able to chain or customize things as well. We're also working on front office automation. So imagine, you call a clinic and you want to book an appointment. We're soon going to have the ability to have, an AI answer the call and book or rebook the appointment within your calendar. And so, those are kind of other additional features. But essentially, we've built like a very comprehensive suite of features, and we still have like a lot more ideas that we're building out. And then along with that, the integration piece too.
There's so much to unpack there. I have so many follow-up questions. Okay, so I'm going to target them one at a time. So Amaan, when you said that you can cater to chiropractors, physiotherapists, you name it, and you both mentioned the customizable point. Is that like the template? So how does it customize to, so regardless, whether I'm a physiotherapist, I'm a pharmacist, how does it customize to me? Like I build them or I choose which templates I want? How does that work?
Yeah, so we have a few ways. Yeah, Amaan, go ahead.
No, yeah, we have a few ways to do it. So like, I mean, this is like one of the design challenges that we had early on. We wanted to figure out a way to make it easy for like all healthcare professionals to come in and say, this is my template or this is my note style, and I want you to copy it and make it so that it's automated. And so that's exactly what we did. So we allow for any clinician to upload a sample of their work, a sample like template, a sample piece of writing, a sample like consult letter. Scribeberry will learn from that sample and recreate it so that they can be used in patient encounters. So it's fairly straightforward, and from there you can modify it, you can add styling and add formatting, but bare bones, that's like the quickest way to get started. So you don't have to like try to figure out how to prompt engineer or anything. It just makes it simple for the clinician to kind of figure out on their own.
And so is it also an extension or is it integrated to their EHR? Like how does it populate? So they just, do they have it on the side and they copy and paste it? Like how does that piece work for them to carry it over into their electronic health record?
Yeah, it's so we have a couple different options. So bare bones, it's a web application. So we have like a desktop version and a mobile version. And then we also have like these progressive web apps that have like desktop native and mobile native. So like on iOS, Android, and Mac and Windows. But then we also have this Chrome extension that's kind of working in the background. It's not publicly available just yet, but it is there as well. So typically the workflow is you have like this tab, Scribeberry open. You can do in-person visits or telemedicine, like you mentioned. You can share Zoom or Teams or Google Meets, whatever it is, and it'll capture the audio from both sides if you're wearing headphones, or if you're just in person, you can just use either your phone or your computer, and it'll just capture the audio around you. So that's kind of the workflow, and then you can bring it back into your EHR, EMR.
I know, that's incredible. So Zaahir, I have a follow-up question for your piece. So I know you mentioned AI agents. I know we use that terminology quite a bit. Would you be able to expand and explain what that actually means for audience members that may not be familiar with that?
Yeah, so AI agents, the best way to think about it is, AI doing the work that a human normally would. And that's, done in different modalities, whether through voice, whether through text, whether through, video interface or chat. So in our context, what it is that we have kind of, an audio-based agent that can tie into a phone number or a QR code or a link. And then that agent will actually go out with the permission of the clinician and do some of the clinician's work for them. So whether that's taking histories, whether that's booking and rebooking appointments. And as we kind of improve it, the applications for it obviously will expand too. But right now we have it so that it just does those preliminary kind of pre-consult based tasks.
Yeah, the other side of it is the front office side as well. So like if you think of like a physician's office or any healthcare professional's office, it's really tough to get them on the phone. And so that's why there's a lot of like kind of options that like the operator kind of gives you. Like the last option is essentially like speak to a human. And the reason is because they have so many other things to do. And so that's kind of why we are building these AI agents. So if someone is calling and just wanting to find out about like services rendered at the clinic, hours of operation, like fax numbers, things like that, then that entire front office part of it, even like booking and rebooking the appointments, is automated through these AI agents. And so the actual human working in the clinic can actually tend to the patients there and do like the real human stuff. So that's kind of like the backdrop there.
And a lot of clinics, especially rural clinics, a big bottleneck is the front office. You often have like, let's say 2 or 3 receptionists. And if you have like a clinic-based panel of like 15 or 20,000 patients, and phone lines like just it's not possible to always answer all of them. And so, yeah, it's a big problem.
Yeah, no, and I appreciate both of you explaining that. And I think it's so true because actually I was interviewing another physician and he kind of shared what you both kind of just explained. So I'll kind of just share that. And so when I was speaking to him about AI, bringing into the healthcare space, so AI scribes is a big piece of it that is, a lot of clinicians, a lot of areas are using it. And then the next piece we spoke about was automation, like you said, the administrative tasks. So the fact that you guys are trying to tackle that right now, I think is incredible. And like you said, there's so much administrative burden. I know earlier I mentioned for clinicians, but also for the administrative staff. There is also a lot of burnout for them. So how do we augment that? Even with using the systems, whether it's an electronic health record or anything, they're the ones who actually use it quite a bit as well. So ways to augment their workflows as well to empower them. So not just clinicians, but also to empower administrative staff. So kind of to take a step back here, I know Zaahir earlier mentioned that sometimes some patients may not be comfortable with you using the tool with them, right? The consent piece. And so in my experience on both sides, as a patient or even as a clinician, they may be wary about using AI. So how do you bridge that education gap or navigate those conversations? Still being mindful and respectful, whether it's a patient or a clinician. Is that something you guys have come across or any thoughts on how to navigate that gap so that whether you're a patient or a clinician, you're comfortable using AI?
So I think the first point is the vast majority of patients are pretty comfortable with it. I think the challenge is the clinician side explaining, bringing it up. How do I bring it up? How do I explain it? Do I understand it myself? And so we do a lot of work on trying to kind of educate clinicians on that. And then sometimes, there's different workflows to obtain that consent. Do we go through the front office, who consents patients, explains it, have someone trained to do that? Do we do it individually with each patient every time they come in? So that varies from practitioner to practitioner. So that's one aspect of it. And then for patients, I think it all depends on the approach and how you consent the patient. In some spaces, it can be a bit tough. Like if I have, let's say a mental health patient who by nature might be more paranoid, maybe I won't bring it up and won't use the tool with that patient. And if I wanted to, I probably could have that conversation. But then, you have to really be prepared. So I think there's a lot of variability, in terms of kind of how you consent people. And I think it comes back to just understanding your patients, having natural conversations, explaining things, getting informed consent, and then going from there.
No, and I appreciate you sharing that because I think health literacy is so important, right? So like as a clinician, you would be more familiar with navigating the healthcare system. But as a patient, right now, even in our current state with health literacy, that is still a challenge, right? To navigate that, based on an individual's socioeconomic status, so many things. And now we're adding an additional layer, right, of digital, right? So how do you not their literacy of that? So I think it's so, yeah, sorry, go ahead.
And the flip side of that too is, once you start using the tool, patients actually appreciate it more because you're able to send them handouts, you're able to send them summaries, you're able to send them things like right after that visit, explaining every little thing that you said. And then the patients sometimes are like blown away, whoa, this is everything you just said. I remember it. And you don't have that patient, let's say, coming back in a couple of weeks asking about it. So there's a lot of downstream benefit to it too, that sometimes when you're consenting patients, it helps to explain that as well.
So
It's not just
building
that either, right?
Go ahead.
It's like being able to have that face-to-face conversation with your patient from the provider side. Like that's kind of why they got into healthcare in the first place. And so to allow them to come back to that, I think a lot of providers have been very, very grateful to like the software, this like entire industry. So it's been good.
Yeah. No, I appreciate you both sharing that. So when you say patients also, so is it a patient portal or based on your EHR, if you have a patient portal, you can send that, like you said, a PDF of their visit, or how is a patient able to access that portion?
Yeah, right now we don't have like a dedicated patient portal for that, but because Scribeberry is used so broadly, it's up to the user. So the clinician can either download a PDF, hand it to the patient, print it, hand it off. They can email it to them. They can fax it. So there's different methods they can use, but we leave it up to the clinician to kind of decide.
Yeah. And I think that's so incredible because like I always tell people we're all patients. It doesn't matter your title, your profession, what have you. We're all patients, whether in the past or in the future or a loved one. And so I think another key piece that there's a conversation about, patient empowerment and patients being able to have access to their data. And like you said, to interpret a lot of the concerns, like even with us, we released a feature called View Client Data, where patients in our patient portal, they can they can view certain aspects. So that could include their demographics, their care team, their diagnoses, their lab results, and their medications. And so as a vendor, we cannot withhold patient data. But our clients, they can choose whether or not they want all those points to be shared with their patients in the portal. And so sometimes the clinicians will have concerns like, oh, if the patient sees their diagnoses or what have you, or their lab results, they may not understand it, and that may overwhelm them, or it may open a can of worms that they don't want to open yet, and they would want to discuss with them. So I think your piece that even with my session, when you're the patient, sometimes it's hard to keep track of everything. Me being in the healthcare system, like I make note of that. My sister, she's a lawyer. She's like, I don't know what you're talking about. So I think it's also that. So I think it's so important to have patients have access to their data. And so the fact that your tools allows you to do that, I think is so important. And maybe I'll even kind of tap into both of you and your thoughts about that with patients having access to their own data. I know there is a lot of work to be done. I know interoperability, there's so much, but just maybe your thoughts on that your tool also encompasses patient empowerment, patient data. To an extent, based, like you said, it's clinician organization based, how they exercise that. But any thoughts on that piece from both of you?
From a health provider standpoint, like I'm all for patients having access to their own health data. And sometimes there's a bit of controversy because, some docs will say, well, if they don't really understand it, they panic. But I think that's fair, whether you tell them in 2 days or 3 days, or they find out right away. I mean, if it's bad news or uncertainty news, the initial reaction is going to be panic maybe, or lack of understanding, and they'll come see you anyways, right? And I think like just putting the ball in their court, sometimes like empowering them, it's better overall for them. At least that's my somewhat biased opinion, I guess. And there are like pros and cons to each, like do we share the info or do we just let them see it? But I think at the end of the day, the patient's responsible for themselves and it's their own body, their own health. And so, yeah, I think the less barriers to access, the less barriers to knowledge, the better. Yeah.
I tend to agree. I mean, like, again, speaking from like a patient perspective, it would be nice to have like even like the full transcript of our conversations with the provider, because then I can look back and be like, oh yeah, that's what he said. Because like, I mean, as a patient, like I'm not going to understand all the medical terms and jargon that the provider is giving me. But if I have like maybe like a document that kind of outlines that, then I can maybe take my own health a little bit more seriously. And just on that note, we have been thinking about like doing like a patient side for Scribeberry as well. And essentially you would have access to things like that and you can ask some questions and stuff. Yeah, I guess that answers your question.
Yeah, absolutely. And that's amazing that that's actually one of my future questions. I was going to ask you about long-term goals of, what you guys are thinking about. And I think that's so beautiful that you're thinking of the patient side, because like we said, even us as patients, like I had an injury. And this was years ago. And so then because I've always been in the healthcare space, I need to ask for copies of my ultrasound, my x-ray. So like I said, dating myself, but like I had the CDs of it where they had my x-ray and my ultrasound. I carried it with me to my physiatrist, my family physician, my sports physician, my lab results. I had like a paper file that I took with me to all my appointments. But I knew that because I'm in the healthcare space. Like I said, my sister, she's not. She's on the legal side. She was like, I wouldn't have known to ask for those things. And I also had to pay for those CDs. $2 then, but I pay for it. But it's my own data, right? I should have access to that. And so I think it's so important. I think it's beautiful that you guys are considering the patient side in your future goals. Kind of building back, and closing the loop back to. Oh, sorry. Go ahead.
I just wanted to mention something because you mentioned like about the patient data and stuff. So actually, my wife is just talking about this. So she used to work in Alberta and now she works in Ontario. And there's a slight difference in terms of like what you have access to. So there's a very centralized kind of place where you can access some things like X-rays and blood work and stuff for physicians. It's called Netcare, I believe, right? On Alberta, but there isn't that available in Ontario as a centralized thing, and so patients end up suffering. And so yeah, like I totally understand what you're feeling, and I mean, like a product like Scribeberry could house some of that information to make it easier for access for the patients. So yeah, totally get it.
Yeah, no, I appreciate you sharing it because I think that's so true, right? Because if I didn't carry those X-rays and ultrasounds, when I went to see others, they may not have access to it. My family physician would, because she's the one who referred me to get those tests done. But the others, my physiatrist wouldn't get it. My sports physician wouldn't get it. So I think that's so true.
And again, it adds more work for the physician side as well. Like they have to go and collect all this information, call different offices and get all that. So again,
Yeah.
more burnout.
Well, yeah, and I think it's also crazy, right? Like even like, within Canada, because our healthcare systems are delivered on a provincial and territorial level. So we each differ. Like you said, even province-based, we are so different, like the way with Alberta. And then also right now we're based in Ontario. So it's crazy to see those differences as well. And also kind of sheds light on how we can learn from one another, right? To be able to build similar pieces as well. So kind of bringing it back to your product. So if you're comfortable sharing, is your clientele mainly like individual clinics? Are there larger organizations? Or even in general, like being mindful of confidentiality? If there's some exciting use cases that you guys can share, or some stories, some success stories that you've heard from clients that you can share with our audience with regards to your tool.
Uh, um, so I guess in terms of kind of our clientele, majority are kind of small practices. So we've made a conscious choice to kind of, our go-to-market has been smaller clinicians and individual clinics. And the reason is, these are the places where burnout, I think, is heaviest, especially in rural areas. And there's less friction to adoption, because people are looking for a solution. Whereas in hospitals and kind of bigger networks, you're often bogged down in bureaucracy. So that's been our primary go-to-market and client base. It's been doctors, family docs, psychiatrists, specialists, rheumatologists, just in areas that are more rural, semi-rural. Yeah. In terms of kind of success stories, I mean, there's a lot. We've had clinicians say that this was kind of the first time they've been able to take Christmas, with their family without having to write a note. And we've had feedback where, yeah, just incredible things like, it's the first time I've been able to like go for a vacation or take time off or enjoy things. It's been, yeah, that stuff, is kind of validating to hear back.
There was
but
one,
yeah.
Zaahir, like, it was like pretty early on. It was almost a year ago now. So there was an article or a news segment that came out on Global News. I can't remember the physician's name, but she basically said that AI scribing is what brought her back to medicine. So she was actually going to leave the profession, and she came back to practice because of AI scribing. And they did like a whole like video kind of interview with her. And she didn't mention us, but you could see on her screen on the computer that she was using Scribeberry. So like just internally from our team, we were like all like super excited about that. We were so happy to kind of see that, oh, this is kind of the effect we're having on these providers.
Oh, that's incredible. And I think that's so true. Like, I think the administrative burnout is real. Like, the struggle there is so real. And I think that sheds light to it that a lot of clinicians, especially family physicians, at least in Ontario, there's a shortage of that. And so I think, seeing or hearing those stories that, tools like this can empower. Like, even for myself, being in the health informatics space, I truly believe that technology has a way to empower patients as well as clinicians to, provide more efficient care and all of that. And so I think it's beautiful to hear that a tool such as yours, it was able to help. If that's one clinician that came to the forefront and share that story, there must be so many others. So I think that's beautiful. Like I said, in Ontario, we have a shortage of family physicians. So if another family physician can use your tool, and that will bring them back. We need all of them that can come back. So I think that's amazing to hear that. So in terms of the tool, like in terms of future, like I know you said you had that patient aspect in mind, and I think that's wonderful. Are there other aspects that if you're open to share, like, future long-term goals or short-term goals, even in the next couple of months that your clients or even those around can be aware or keep a lookout for? And then second fold is in terms of evaluation, like, are there certain data metrics? Like I know Zaahir, when you mentioned that, I would finish clinic at 4:00, I would not leave until a couple hours later because that's when I did my documentation. Are there metrics that your platform collects, so it allows for greater adoption? It also and you can see the changes and that you are kind of implementing through your product. So I know that's twofold. So if either one of you want to tackle it or take a step back, whatever you both prefer.
Yeah, I'll tackle the second part, which is more like just in terms of kind of metrics around, time saved. So we were part of the OND study on AI scribes, along with a number of different AI scribes as well. And really the highlights from that study showed, about 70 to 90% of participants said they spend less time on paperwork, and 3 to 4 hours additionally were saved on administrative tasks. And almost 83% of participants said they would use this AI scribe in their practice long term, or recommend it to their colleagues. So there were a lot of positive results from that, validated kind of independent study done by Ontario MD. In our own background, we've run surveys with our users. And one of the interesting things that came up, I think, is that 33% of our users said they would consider taking on more patients. And if you think about that, right, in the context of like a shortage of clinicians or unattached patients who don't have family doctors, like there's not much that would have like a 33% impact on, reducing kind of the amount of unattached patients to family docs. So that was huge to us. If like a third of our users are willing to take on more patients, how much can that alleviate off the system? But there's so many downstream benefits and implications that I could go through on that. But that's just kind of a broad overview. I'll let Amaan talk about kind of future things that we're doing a little bit more. But
yeah, so I mean, we touched upon some of this stuff, but I also want to be a little bit wary because, as you know, the AI scribing space is quite competitive. So I'm basically we're going to give out our entire roadmap here, but yeah, but that's okay. That's okay. I think it's always up to the provider, right? Like they are ultimately in charge of kind of what decision they make and kind of whatever works best in their workflow. And that's kind of where we come from, right? Like we are always thinking about what is going to optimize workflows. And so one of the things we mentioned is the AI agents, right? So the history taking side and the front office side, I think, will not only help the workflows that we discussed earlier, but then if you think about that while it's connected to an integrated EMR like TELUS, Akiro, like Epic, whatever it is, you can actually have the AI agent not only collecting the history from the patient, but then also integrating it into the different fields within Epic, and then like executing on the next task. And so that's kind of where we're headed. This automation can literally do all of the documentation and the administration side that a human would literally have to click through every single part of like the UI and go through themselves. And so now you can actually have asynchronous work, if you know what I mean. So you can have the patient speaking to the AI, collecting whatever information, patient handouts, patient availability, scheduling those appointments, and then pushing it into Epic. It all is done. Then you can have the provider actually speak with the patient, and that's kind of their interaction. They're not constantly looking at the screen. They're not doing anything else after or before. It's just like kind of done. So I think that's kind of where we're headed on the AI agent side. And of course, we have a lot of integrations coming. So the big ones we have kind of in the works already. They should be out fairly soon, and then we're working with a number of smaller kind of EMR vendors. We also have like an API that we're releasing. Like it's basically a way for our backend to be able to speak to anyone else. And so if you are like a smaller kind of EMR vendor, you can take advantage of our API and do certain things with it. But yeah, there's kind of a lot. Like the forms was kind of really big. Like I don't think anyone else is doing forms the way we're doing them. It basically lets you just like upload a form that you may have, maybe a requisition form for an X-ray, like that's internal to your own hospital. And you just upload the form and then it'll automatically get filled out. So again, just thinking about all these different workflows and adding them into the Scribeberry platform is kind of our goal. And I just wanted to mention as well, you mentioned just being able to track certain usage metrics and stuff. So we were very careful kind of early on because healthcare data is such like it's a coveted kind of like database essentially. We have to be very careful to make sure we're monitoring it and being like kind of compliant with all of the regulations. So yeah, we're not really collecting any data besides like usage, like how many times was something used. And so we're kind of like constrained in that way, but we rely on some of these surveys that Zaahir mentioned to collect some of that feedback from our users directly. And I think it's better this way because we speak to them directly and they tell us, oh, like this is kind of what I wish Scribeberry did. And our team is very nimble. We're like very quick to kind of build stuff out. Like I'm also like an engineer. So sometimes I go in the code now and I just build something out quickly. But yeah, like that's kind of our workflows or day to day.
Yeah. Yeah, no, and I appreciate you sharing. I'm cognizant it is very competitive, so I appreciate you sharing whatever you could share with us. So mindful of that. But I think that's so exciting and incredible. I love the piece where you mentioned where through the AI agents where, it collect information, populate fields for the clinician. So when they're, during their session with their patient, they can provide them that care. And I think that's so critical because in being in the health informatics space, that is one piece that is flagged, right? When electronic health records were first brought in, like the physician's back will be facing the patient. And then a lot of clinicians will say that a lot of the times, in addition to what the patient is saying to me, I need to observe them at large. As I'm sitting in my office, they enter or they're already there, the way they're walking, are they slouched? That tells me certain things, that they are in pain. They are leaning more to one side. So their body's compensating because maybe they fell or you name it. So I think that's so critical to allow the clinician to have that time where they are actually looking at the patient, providing the care that they need, and not in the back of their mind that I need to fill out X, Y, and Z. I think there is some space for that, but also to allow them, empower them to provide the care that they need. And so, and as well as so much of the other pieces that you said, the integrations and all of that, I think it is so critical and so exciting. So super pumped to see all that being released. Zaahir, I did have a follow-up question for you. I know you said that you had mentioned where, like, in addition to it alleviating a lot of time, it could allow a lot of clinicians to take on more patients, and there's some more downstream effects that could be quite beneficial. And I know you didn't want to dabble into that, but if possible, I wanted to ask you if you could share a couple of those. And the reason I say this is because I forget where this was, but in Ontario, there was a family physician that opened a clinic, and there were 1,000 patients that lined up so that they could, join that family physician's office. So if there are other things that you can share, please do. So I wanted to hand that over to you if you could share what those downstream effects could be, so that maybe others would be open to using it as well.
I think so this is kind of more bigger scale, like on a government or policy level, and just kind of, adopting these tools will improve access to care. I think that's kind of the big picture. So one, if you have doctors taking on more patients, obviously, patients waiting for a provider reduce. So that's just direct. Indirect, if you're a clinic looking for a physician and you bring on a tool like this, suddenly you'll have doctors who maybe, are doing something else. They might consider coming back and doing more, let's say, in clinic or primary care work, which previously is seen as administratively heavy and underpaid. So now, you kind of are able to see more volume, maybe bill a bit more, maybe have less time that you're spending on tasks. Again, the downstream consequence of that is that access to care piece improves. You have doctors less burnt out, so you have patients who generally are happier and able to kind of engage a bit more, and that also will have positive impacts. I'm sure somewhere down the line in terms of just outcomes, patient understanding, like we went through, and kind of comprehension of their illness, reducing kind of unnecessary visits, reducing kind of time maybe spent in the ER. So it's really overarching, and I know it seems like a lot based on a simple tool, but when you look at the data that's come out in studies, with AI scribes, it has that potential, and I'm sure at some point we're going to see the government kind of jump on this and use it, whether politically as a tool or actually, implement it. But that's kind of I'm sure there'll be that aspect of it as well at some point.
I appreciate you kind of walking us through that and kind of connecting all the dots through what both of you have kind of shared. Just bringing it back to your entrepreneurial journey, just wanted to ask you both in general, and you can take us whichever way you want, and I'll tap into both of you. Were there certain challenges when you were trying to enter the space or in your journey at large? Are there certain lessons learned that you would want to share? Anything you would do differently, or advice that you would have for other entrepreneurs? I know that's a wide scope, but I want to allow you both, whichever route you want to take us, whichever route you want to share with the audience. So any challenges, lessons learned, things you do differently, or just any advice you'd give to other entrepreneurs in the audience. So I'll open it up to either of you. Would want both of your takes. So whichever one of you wants to take us first, and then the next one as well. So I'll open it up.
Amaan, maybe go on.
Yeah, sure. I can go first. So, I think just overall, I think it's been super fun. I think fun is a good word to describe the feeling that I have when running Scribeberry. I think Zaahir is laughing. So we're friends, we played soccer together, and that was kind of our life or our relationship at the time. But it's kind of grown since then. Obviously, we've been to each other's houses in Edmonton and in Toronto now. We had tournaments here, so we spend a lot of time together, and it's just been fun, being on and off the pitch with respect to business as well. So yeah, it's been fun. Challenges have been a lot. Early on, we didn't really know what to expect, like I mentioned, and we kind of just put it out there, and we were just testing different things and going to Facebook groups like I mentioned, talking to people, speaking with them on the phone, going to our individual networks and kind of reaching out. So that part was also fun, just like figuring out ways of marketing this new tool that we've built. So just like working through like, oh, like what can we do? Like, can we like, I think, I don't know if I should mention this, but one of the things we thought about was like every like physician's office has like a fax number. So we just like started faxing people very early on. Like we didn't know what like repercussions we're gonna have, but a lot of them were like, "Oh, this is cool." Some of them were really upset and they said, "Don't fax us." But it was fun. It was fun to do that. Like it was fun to like come up with new ways of reaching out to possible customers. And then yeah, just like from home, like I basically like from my own timeline, like I had a baby like 2 months after we started Scribeberry. And so that was a little bit challenging. My wife was working full time, like in Edmonton. And so I had the baby like literally on me when I was doing demos. So it was fun, but at the same time, it was challenging because I'd have to schedule my demos so that it aligned with nap time. And like, it was kind of tough. And then also like we just did a move recently back to Toronto. So that was also kind of tough, and being away from Zaahir has been a little bit challenging, but I think it's been okay because remote is the way to go. And I'm going to Calgary in a couple of weeks, and maybe I'll see Zaahir. And Zaahir was here for a soccer tournament recently, so we still obviously get to see each other face to face, but we're obviously always on chat and video every single day. So yeah, I think to describe it, I think it was like a fun journey. Yeah, I don't know. Hopefully Zaahir feels.
Yeah. No, it's super enjoyable. I will say, like, us as a team, we're not formal, right, with each other at all. So like we literally can talk about anything candidly. We could get mad at each other. We could really be upfront and honest. I think that's a huge plus in doing business together. So we don't have that corporate feel, maybe that you might have. You actually have to schedule meetings and times to talk. Like, there are times where we make business decisions at 4 a.m. and that's probably more common than the opposite, of like, hey, let's talk in the morning. So I think as a team, we're pretty innovative, we're pretty creative, we're off the cuff, we're very adaptable and quick, and that's been a strength. And I think just naturally being surrounded by business owners and being kind of a child of an immigrant, honestly, that hustle and that innovation is kind of drilled into you and that want to succeed. I think challenges where, at least from my perspective, is kind of organization and time management, especially having a family, having other responsibilities. I think balancing that's really tough. And so that's kind of been the biggest thing. Like there's so many times where I said, if we had unlimited time today, we could get this done today. And Amaan and I are those types of people where we want to just ignore everything else that's going on in life. And if there's something we want to do, we're going to do it for like 16 hours until it's done. But you can't always do that. So I think that's the challenge for us personally. In general, like, entrepreneurship, it's a lot of fun. It's challenging. It's a lot of critical thinking, problem solving. But I think it's the most rewarding thing that one can do because at the end, you control your own time. And I think that's way more valuable than the income that comes with it. So yeah, that's kind of my little spiel to add on.
Yeah, no, I appreciate you both sharing that. I think the common theme between both of you is just have fun. And I think that's so important with life, right? Whatever you're doing, enjoy it, have fun while you're doing it, laugh at yourself while you make mistakes. And like you both said, like, in your personal lives, you had a lot of new things. Like Amaan, like you said, you had a new baby, right? So that's a challenge within itself, but you still make time for it. And I think that's also with filling your own cup, figuring out, understanding who you are. So reflecting, self-reflection, being authentic to yourself and being able to figure out what your passions are. And like you both said, you will sit 16 hours to figure it out. 4 a.m. you guys are making calls. So when you're able to, and being cognizant too with the audience, that sometimes that's a luxury too, to be able to figure out and be able to pursue your passion and be able to dedicate that time. So being mindful and respectful of that as well. But I think at the end of the day, like both the gentlemen have shared, as long as you're having fun while you're doing what you're doing and figuring out what you that ignites you to pursue it that way. This kind of pretty much brings us to the end. Thank you both for taking the time and sharing all your knowledge, right? Both, in terms of your product, also your personal experiences being entrepreneurs, and also in general about the healthcare system so others can learn as well. So thank you both so much. Really appreciate it.